Imagine if you woke up and half of your face was drooping down. You might think that you are having a stroke, and you very well could be, but there's another condition called Bell's palsy, which causes paralysis of half your face. And today I'm going to be talking with Pierre Butheau, one of the few people in the world who specializes in treating Bell's palsy. He'll tell you how to distinguish if you are having a stroke or having Bell's palsy, but with an emphasis that either way, you really need to get it checked out right away. So listen in. Whether or not you experience Bell's palsy at any point in your life, I think you're going to really enjoy this episode and learn a lot. I know I did. So stay tuned. And if you like the show, subscribe to our podcast so you get notified of future episodes.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I have with me here today Pierre Butheau, owner of Butheau Physical Therapy in Seattle, Washington. And Pierre has a specialty that not a whole lot of people have heard of or are involved in or know where to get treatment from. And it's actually Bell's palsy, which if you don't know what that is, he'll explain it to you in a little bit more detail, as well as tell you, how this can be managed. So welcome, Pierre. Thank you for joining us today.
Thank you. Thank you for having me.
So Bell's palsy is a really specialized niche, and a lot of people may not even know what it is. So can you explain what Bell's palsy is and how you got into treating it?
Yeah. So Bell's palsy, which is named after the Scottish neurologist, Sir Charles Bell, is a form of temporary facial paralysis that is resulting from damage or trauma to the facial nerve, which is one of your cranial nerve. It's caused by the inflammation, swelling, and or compression of the facial nerve. It is the most common type of facial paralysis. And generally, Bell's palsy affects only one of the facial nerves on one side of the face. However, in rare cases, it can affect both sides. It's considered an idiopathic, meaning the exact cause of or the mechanism is unknown. The studies over the years have shown that it's very likely linked with a viral infection, and various viruses have been associated with Bell's palsy. The most common one being the herpes simplex virus, so your cold sore and genital herpes virus, which is actually dormant in most of the population. Another common one would be the chickenpox or shingles, also called the varicella virus. Other viruses linked to Bell's palsy include the mumps, mononucleosis, HIV, some cytomegalovirus, and various viral respiratory infections. And also, not a virus, another common one would be Lyme disease, actually. It's one of the common reasons, and Bell's palsy is one of the common symptoms. So if you live, for example, if you live in the Northeast and the Midwest, where Lyme is more prevalent, and if you develop facial paralysis, I would highly suspect, always suspect Lyme, especially if you've been on a hike or have noticed a insect bite somewhere. So Lyme should always be ruled out because it's an infection. and not a virus. And so the medical treatment would be very different for Lyme disease. So Bell's palsy, you would use steroids, and Lyme disease, you actually need some antibiotics. So that's something to keep in mind. And then overall, I think not to go into too many complicated details, but basically it's believed that the facial nerve becomes inflamed following an exposure to any of these viruses. And often the patient will describe a period of higher stress around the time of the onset, and or a long exposure to cold weather or cold temperature just before the onset of their Bell's palsy episodes. With that inflammation, the facial nerve becomes swollen, and since it exits the brain and the skull through a tiny opening in your skull, on this just very close to your ear, actually. So the swelling of that nerve against your skull will disrupt the communication to the muscle of the face on that side. So pretty much in a nutshell, that's Bell's palsy, and you have a 6% lifetime chance of developing Bell's palsy, and then a 15% to have recurrent episode after that, if you've already had it. And both males and female are affected equally. And if you are diabetic, type 2, if you are pregnant, having a family history, or having recurrent respiratory infection, those are a risk factor that puts you more at risk of developing Bell's palsy. And personally, so how did I get into treating Bell's palsy? I had been treating Bell's palsy actually fairly rarely, like most PT, as you know. We don't see this kind of patient too often entering our clinic, and I think I can probably count on one hand how many I saw in the first 10 years of my career. And back in 2016, actually, that's when everything changed for me, as I became the patient. I was diagnosed with Bell's palsy myself. And thankfully, I knew right away what it was, and got the necessary medication from my physician. And then I started treating myself right away, fairly aggressively on day one. And within 10 days, I was back to normal. It normally takes about, at least they say on average, 3 weeks to 6 months to recover. And around that time, I also kind of realized the lack of knowledge on the topic from medical professionals, and the need to help and educate people with Bell's palsy. I think most patients, besides their diagnosis and being prescribed medication, they're not really recommended any treatment. So if you're lucky, you'll be maybe sent to a physical therapist, but even that, I don't think a lot of physical therapists know the ins and outs of treating Bell's palsy without being their niche or reading extensively about it. So yeah, I studied a lot and research, read a lot of research paper, read many books on the topic, along with treating and healing, I guess, an exponential number of Bell's palsy patients. So I feel like Bell's palsy is not complicated to treat as long as you follow certain rules, sequences, and timelines. So yeah.
Oh, wonderful. You know, because Bell's palsy causes like a facial droop, kind of like you would see in a stroke, you know, a lot of people who are experiencing that kind of start to wonder, well, am I having a stroke? What happened? Are there any ways that people can tell a difference versus if they're having Bell's palsy or a stroke?
Yeah, and actually that's very relevant here, because that's kind of, you know, for me, when I had Bell's palsy, that's kind of the first thing I did. So basically the droop that's experienced by most people with Bell's palsy, it's quite frightening at the first time you see it, when you first experience it. And often people will first notice their Bell's palsy waking up in the morning, or often when you eating or drinking and being unable to seal their lips and drooling, or being unable to blink. So one way to tell if it's Bell's palsy versus a stroke, it's to look at your overall strength and ability to for example, to move your arm and leg on the side of the facial paralysis. So if the weakness is experienced only in the face, there is a high chance you're dealing with Bell's palsy or some other type of facial paralysis. Bell's palsy being the most common, but there are some other type of diagnosis that I'm not going to go into details here. But with a stroke, for example, the common symptoms is hemiplegia, and you'll see significant sudden weakness in your arm and leg. So if you experience facial paralysis, I would test your ability to walk, your ability to go from a sitting position to standing and getting back to a sitting position, moving your arm above your head, reach and lift something moderately heavy, test your balance. So, and of course, strokes come in many different type and intensity. And if you experience those facial symptoms, you should have a physician diagnose you as soon as possible anyway. And the first 48 hours are key in Bell's palsy. All the studies points to the fact that people that start the steroidal treatment within 72 hours versus earlier. Beyond 72 hours, you will have a longer recovery. So yeah, so that's an easy, quick, easy way to find out if you Bell's palsy versus a stroke. And of course, a stroke is diagnosed by imaging. So, as you know.
So one way or the other, you see a facial droop, go get it checked out right away.
Yeah, that would be stroke, really. Absolutely.
You need to take care of it right away. And if it's Bell's palsy, you need to take care of it right away. Pretty
much, yeah. If you have Bell's palsy, you're pretty much lucky. If it's a stroke, not so much, but you have to really have it checked, because there's a lot of strokes that are very light, and or something called the TIA, for example, and you could have some symptoms that are very mild, but you still had a stroke. So always a good idea to go to a doctor.
Very good. You mentioned the viral link to it, and the fact that, the herpes virus or things you get that cause cold sores can be related to the development of Bell's palsy, as well as the fact that they're worse in cold weather. Why do you think that link, that the cold weather starts to bring it out?
That is a good question. So that's something that I don't think we really know too much about. And it's the same thing with Bell's palsy. And I think maybe that's why also a lot of medical professionals don't know too much about it, besides the regular treatment with steroids, but the source, the origin of the condition, which virus is responsible for that. I think that's often something that I'm being asked by patients is, where do you think this is coming from? And very often I'm doing that detective work to find out what other virus they've had in their life before, what they could have been re-exposed to. It doesn't really help with the treatment. So it's something that it's almost a moot point knowing, because people tend to really focus on that. And a lot of people around that time of the diagnosis are very stressed anyway. And I don't think that really helps in the whole treatment and the ability to not stress, and because stress is a major factor in slow recovery. And so if you're somebody that's very type A and stressed, or can be stressed easily, having Bell's palsy could be a problem. But yeah, I don't think we don't know so much still about this diagnosis. And I think that's why most patients' questions are not answered by their doctor when they are first seen. For example, one common question would be, when do you think I'll be recovered? And that's really an impossible question to answer this early on anyway. But I think if you haven't noticed any progress within, or any changes at all in your facial paralysis within 3 weeks, I think you need to really be more proactive and really seek help, because anything after 3 weeks, the prognosis kind of becomes less and less positive. So, yeah.
So it's important to get it checked out right away and start treatment as quickly as possible. You mentioned steroid treatments being one of the treatments. What is it that you do that helps people recover that's obviously not injecting steroids?
Yeah. So first, I want to say that I'm a big advocate for proactivity in treating any kind of medical problem. And it's my opinion that a wait and see approach really works. And I see too many people with Bell's palsy doing that. But waiting for a problem to change without changing anything nor knowing what to do to change it will not help. So some injury requires a certain amount of rest, obviously, but Bell's palsy being a neurological condition, it's even more important to regain nerve function as soon as possible in order to make or expect any improvement at all. So it's kind of a pet peeve of mine to see or read online about so many people affected by Bell's palsy not being involved in any active treatments or having been told to wait and see, sometimes by their physician, very often, as they don't have really much more answer for them, only to find out that several months later that it was just waiting was of no help. So I don't blame them. I think it's mostly because they have not been told nor recommended to do anything by about 95% of the doctor they've seen. So also because this doctor don't know some people like me can actually help their patients recover faster and fully without any long-lasting facial deformity or asymmetries. So Bell's palsy has been considered for too long, I think, to be only a transient diagnosis with only a rare complication, which is not what the numbers are really showing. So 29% of Bell's palsy patient will have complication, and that's a big number to me. That's almost 1 in 3. So there is almost no study following Bell's palsy patient at time intervals to assess possible remaining deficits, and I think that would be actually quite interesting. So I'm hoping my work on the web and in this podcast will help towards spreading the word about Bell's palsy, physical therapy, physio treatment. So I would sum up my work as teaching Bell's palsy patient the ABC of Bell's palsy treatment and how to massage, stretch, and retrain each facial muscles and motion individually using various techniques, visual and tactile feedbacks. The main key to remember, I think, here is individual muscle retraining. Facial muscles are linked to emotions, and they work very differently than other muscles in our body. They're not strong muscle, and over-contracting them is never a good idea, as it tends to retrain them to work all together instead of individually, which can lead to one of the most common complications of Bell's palsy recovery, and that is called synkinesis, and that means simultaneous movement. It's an abnormal synchronization of the facial movement where the muscle, other than the one you are supposed to move, actually contract together during a particular movement pattern. So, for example, the most common type of synkinesis would be movement between the eye and the mouth. So, for example, closing your eye or blinking, whenever you smile, you grin, pout, or do any type of mouth movement. That is one of the most common. So what I do is teach people the right way to retrain each individual facial muscle in a way that does not lead to mass contraction. And this is also why I think electrical stimulation tends to not be helpful and could actually reinforce that synkinesis we talked about. I really discourage people with Bell's palsy to use electrical stimulation without the proper education and from a professional. In my eye, there's only one type of electrical stimulation that can be beneficial in treating Bell's palsy, and that is not a common one that even most PT know about. So, contrary to what most people affected by Bell's palsy found out after researching on Google, there's much more than that can help besides rest and taking vitamin B12 and acupuncture. So yeah, so that's basically what I do. It's more of an active treatment, specific exercise, targeted exercises, and in more rare cases or cases that don't improve or that have been around for longer, I will use a galvanic stimulation. And I would really, to anyone that listen, I would really recommend not ever using any electrical stimulation that you can obtain online or Amazon, and use TENS units or neuromuscular electrical stimulation with big pads on your face, because that will stimulate too many muscles at once, and that can create synkinesis. Yeah.
So when you're talking about synkinesis, all the muscles contracting at one time, kind of like someone who had a stroke, they lose fine motor control of their hands. They might just move their whole arm in a pattern that's kind of gross and not really detailed. The same thing happens with the facial muscles.
Yeah, that's correct. Exactly. It's the inability to isolate a facial motion or emotion by itself. So you would basically you will be frowning and smiling at the same time, or closing your eyes and smiling at the same time. You'll and generally with synkinesis, you have quite a bit of tightness in your face. You have actually some fibrotic tissue that has built over time, and that creates this. But to make this very easy, the synkinesis happens because of a abnormality in the rewiring of the facial nerve as it heals and grows back. You have branches of that facial nerve that are supposed to go to one muscle actually end up attaching to another. And that's how, this is a very simplified explanation, but that's pretty much all people need to know.
Another thing you mentioned was the link to our facial muscles to emotions, obviously with smiling and frowning and grimacing, grunting our teeth. Those are all kind of things we use to express ourselves. Do you see depression develop in people who have Bell's palsy, especially if it goes on untreated?
Yes, absolutely. It's actually a pretty big portion actually of people with Bell's palsy, because it's most people, when it first happened, they'll have a period of 1 or 2 weeks where they feel drained, very fatigued, and then especially if you don't see any improvement, it's very quickly affecting your morale, and it's very emotional. I hear, read, see patient, chat with people that have had Bell's palsy for months and sometimes years, and there is a high emotional and depression level in people battling with chronic effect from Bell's palsy that has not recovered. So that's also something that needs to be addressed by the right professional, because I think with the stress, the depression, yes, there's a lot of all these factors that can really affect the recovery for sure.
So you mentioned your ABCs of treating Bell's palsy with the massage and the stretching and the specific muscle reeducation, and how important it is to start that right away. Are there any specific tips or pieces of advice that you would give to someone who's looking at starting those things up?
Yeah, so I think the question I get often is, who can I work with and where? And that's the difficult part, is finding somebody that's trained in Bell's palsy. Of course, I would do some online search. I know in the US, there's several clinics that are where they have physical therapists that are trained in working with people with Bell's palsy. I would also always check with a facial recovery type clinic. So generally those are otolaryngologists or ear, nose, and throat doctor. Generally they have the most experience in treating facial paralysis, both conservatively and through surgeries as well for the worst cases. Neurologists can help as well. I think a lot of people go to the neurologist, but they're not necessarily trained too much in Bell's palsy and don't get the answer they need. But I think a PT and an ENT would be your best choice. And that was also the reason why I created an online tutorial that's available for people that have Bell's palsy to have from home, as I was getting a lot of questions from people and where to find someone to help me. And I created an online course that people from all over the world can get, and it is subtitles. So if my accent is hard to understand, that'll be helpful. Other than this, I think the main thing to remember is the number one of the ABC is get seen by a doctor. This is not something that's going to go away on its own. It is not normal to have half your face not working, and nothing should be alarming enough to bring everybody to a doctor. Once you're at the doctor, get prescribed with steroids and antivirals. So antivirals are not always prescribed, but I would highly encourage people to really beg their doctor for it if that is not part of the doctor's prescription, because most of the studies shows that if antivirals are given, the recovery is more likely, is likely faster. And also if you fall in the 29% of Bell's palsy patients that will have a harder recovery, and possibly from an actual different symptoms, different type of facial paralysis, such as Ramsay-Hunt syndrome, which is much worse than Bell's palsy. All the studies shows that if you have gotten antivirals, that is the first step to improve. So that is a key. So I think, to go back to your question, I think the hard part is finding someone that's versed in this. And my advice would be, if you have Bell's palsy and are looking to work with a physical therapist, would be to give them a call and ask what they know about synkinesis. If they don't, I would stay away from that.
Good advice. So what other things besides the steroid treatments and the antivirals and the physical therapy can someone do to recover faster from Bell's palsy than, say, taking a wait and see approach?
Yeah, I think a lot of people, after doing research, will find out that a lot of people are recommending acupuncture. So acupuncture, I think, can be helpful, especially if the first few days are painful. As well, it can be helpful for relaxation. I don't think there's a ton of studies showing that a concrete improvement from the acupuncture itself. But acupuncture, some studies have shown that the needling could be starting an immune reaction. And you could also be using dry needling, which I know a lot of physical therapists in most states, I believe, are using. I would recommend that dry needling for Bell's palsy. The other thing that I can think about top of my head that is readily available would be vitamin B12. A lot of people wonder if that is helpful. And I think all the studies shows that typically vitamin B12 is helpful for a nerve healing, but any studies associated with Bell's palsy and vitamin B12 hasn't been super promising in their results. So I don't think it's probably fairly safe to take vitamin B12, but that's something you can ask your doctor depending on your current level and other medical history. I can't just encourage people to just take a huge amount of it. So I would refer them to their doctor for that, medical doctor. And then besides this, let's see. I would also recommend if you have difficulty closing your eyes, which most people do. There's some milder case of Bell's palsy where the eye is not very affected, but generally that is going to be one of the most uncomfortable, at least it was for me, the first 3 days where you cannot close your eyes and you tear up constantly. And especially at nights, being able to close your eyes is important. So you don't have any bacteria getting into it while you sleep and while you roll in bed on your pillow and all this. So using an eye patch that you can find in a pharmacy can be really helpful for that. And that brings me to a little side note where closing your eyes should be really your priority. With Bell's palsy, that should be the first muscle that you, and first action that you work on, as a lot of eye and ophthalmologic complication can happen from not being able to blink and wash your eye from that natural process. So yes, that would be the first thing to work on, is being able to close your eye.
Well, you've given us a lot of great trinkets today. I know I've learned some things, and I'm sure the listeners have learned things that they didn't know about Bell's palsy. And so if you had to summarize just one or two key take-home points that you'd really like people to remember from today, what would those one or two things be?
Yeah, so I think Bell's palsy, like we said, can be physically and emotionally draining. But I think that the best recommendation I can give to people would be to not panic when you first experience, you see your half of your face not working. See a doctor ASAP to get officially diagnosed and get the medication that are really the golden standard. You need to start with that. You need the steroids, you need the antiviral. Of course, the steroids, that depends on your medical history and your other things. For example, if you're pregnant, you will likely not be given steroids. But I think after the medication, I think that the main thing is to start the facial muscle retraining as soon as possible. So hopefully with a trained physical therapist, or you can have, I'm sure you'll have those link in the notes, the tutorial I created that's available for everyone. I would also remember that the more you wait to take care of this, the longer your recovery will be, and the higher the chance of the complication. So it's really act on it as fast as possible. And I have recently a patient that contacted me the afternoon of her diagnosis and our first symptoms. I started treating her the following day, and within 2.5 weeks, she was fully recovered. So it is possible to recover fairly fast as long as you follow all those right steps.
So taking the right steps in the right amount of time. Thank you so much for being here. It's been great. And, I wish you all the best of luck in what you're doing.
Thank you very much. Thank you for having me. Have a great day.
You too.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.